Welcome to the consult room, episode 3, hotel rooms and histamine, travel tips for Moldies. Travel should be restorative, not a trigger. In this episode, we're diving into practical strategies to help you navigate hotel stays and travel environments with confidence. If you're sensitive to mold, struggle with histamine flares, or notice symptoms spike when you travel, this discussion is for you. Join us as we cover how to assess your hotel room environment, simple ways to reduce exposure risks, strategies to mitigate histamine flares while traveling, what to pack, and how to prepare before your trip. We appreciate you being part of our community and taking proactive steps toward better health. The more you understand your environment, the more control you gain over your symptoms. We look forward to having you in the consult room.
Hello, everyone, and welcome to another podcast episode with the consult room with Dr. Tami and myself, Dr. Gabby. And we have a very exciting topic to talk about today, especially because Dr. Tami had recently had a good break, an amazing vacation, and she traveled Hawaii, correct, in a cruise, and much needed vacation, which I'm very, very, very proud for her to take her time off and actually do some self-care with her better half. And because of that, we wanted to talk about how can we prepare better? We're traveling and we're dealing with these chronic medical complex issues, such as with mold illness, or let's say if you've been sensitized to mold, or having even issues related to mast cell reaction or mast cell activation. How to better prepare yourself when you are actually traveling, or if you have to go out for let's say you have a conference, or you're going to be spending time even in another town, another country, and hotels and all that, because sometimes it can be very stressful. How you did all your prep, Tami? Did you kind of talk us through what you actually travel with? So, and I can pretty much chime in into the things that I would do as well, because I've had experience with that too. And especially trying to avoid any kind of, if I have any exposure, what I would take also. So those are actually things that our viewers as well as our patients can benefit from. But I know that there are things that you may recommend to your own patients. And I have also my favorite list as well of things that I can tell them to at least try to travel with these items.
Yeah, so thank you, viewers. Thank you, Dr. Gabby, for the great introduction. Yeah, we decided to take a cruise because, as most of you know, and strangely enough, Hawaii got hammered right after we left. Hawaii is super arid, right? If you're going to get a humidity spike or a hotel room that's going to be colonized, probably going to be Hawaii. It's like Austin, unfortunately, super humid, right? And Florida, all these places. So we already knew we choose to travel by cruise ship because we know that if our environment is good, which I've never had a problem with mold intoxication or mold colonization on a cruise ship, but we know that our hotel room is safe. You can't always do that if you're going to fly and be at the Hyatt or the Sheraton in Hawaii. So husband hadn't been before. Very nice. It was a 5-day cruise to the islands, 5 days in the islands, 5-day cruise back with a stop in Mexico. So we always are prepared. I mean, it's a joke. I would love to be the kind of, I always look with awe as, people walk on the plane and they only have the little carry-on and that's all they're bringing on their trip. I feel like I can't even put my supplements and my protective devices there. One of the things
to separate okay, this is kind of like my first aid kit for traveling.
Totally.
Right? Clothing and everything else that you need.
That's exactly right. So there are some things I never leave home without if I'm going to be sleeping in a different place. So my first is probably my molecule travel air purifier. I don't bring it every time. Like this trip, I didn't bring it because we had one night in a hotel before and after. Other than that, I knew we were going to be on a Princess cruise ship and we're going to be okay. So, do you ever bring an air purifier with you, or is that just me being
Yes.
ridiculous?
I mean, no, I don't find it ridiculous. I mean, I've recommended that to my patients, especially my most sensitive patients, because you never know, especially where you're gonna go. I mean, I guess I have recommended sometimes like, hey, if there's a way for you to like call ahead of time, even like let's say you're going to a hotel, you can actually give them a call to find out, you don't have to give them your medical history, but you can say, hey, I'm very sensitive. I do have a certain condition that makes me have a much more larger reaction if I am exposed to mold. So, but for those that let's say like, oh, I didn't have a chance or I don't know, yes, I would definitely recommend. It's always a good idea to carry like an air filter, and which I actually had one that actually broke. So, because, and I'm so glad that we're having this conversation now because spring break is around the corner, and I'm also going to be traveling. So, I actually better start ordering my molecule filter because I was thinking about it, but you're reminding me of that right this evening. So, I need to get one. So I would say that those are usually like go-to items that I would also recommend. So I feel like that is not ridiculous at all. I mean, and they're making it portable, so it
So
shouldn't
small.
be difficult. Now, if you're like wanting to just have like, okay, I only have a backpack because it's a very short, then yeah, of course you don't need to worry about it or stress about it, but it's always a good idea. Yeah, yeah. And what else did you happen to? Well, and if since we're talking about the subject, so that would be kind of like the device, right? That you would carry with you. But did you had like brought anything else in terms of, I don't know, supplements or any other recommendations?
Yeah. So I always bring an ozonator. Now, for those of you out there that have not had contact with an ozonator, can't breathe ozone air, but I have a little travel one that even if you have a backpack, it's literally this big and it's like 24 bucks on Amazon. We'll link it in in the comments so you guys can have that. And that kills like active stuff, right? So typically if I'm staying in a hotel, I'll go into the room, and I did bring that on the cruise. Go into the hotel, I'll plug that in. I'll leave it running when we run to Whole Foods or Trader Joe's or wherever we're going to get our healthy snacks for the trip. Come in, kind of hold my breath, unplug it. Within 5 minutes, all the bad ozone dissipates. So it's a good way in combination with mold candles to be pretty sure that a small space is going to be safe for you. Like you, Gabby, when you're traveling to the Dominican, and I don't know if you're staying with your parents or you're getting like an Airbnb or a VRBO, but that even though you don't know the exact atmosphere, or your brother, you probably know what his house is like. But if you stay at like an all inclusive or somewhere where they might close up that room, turn off the air, and it's super humid in there in between, guests, that's
Right.
something you have to have, or else you would trigger to holy hell.
Yeah, I guess you're right. Like, and we're kind of like doing Airbnb and also staying live like maybe a day or two with my parents' house. I would say that the difference there, which varies when we're like going to hotel rooms or like here in the US, usually is because there's not a like a central, like an HVAC system in the sense that we get a chance to open all doors and windows. So you're always getting kind of like a fresh breeze. Not saying that there's not water damage, it does occur, and but it's a little bit less of a problem. There's not like that, the ducts and all that system, which is where, you can have more of that humidity problem as well. So I guess that's a benefit there when I, going to these places. But something interesting you said about the ozonator, which I was kind of like contemplating that as well. Is that something kind of like, I guess, okay for in a carry on, or you have to put in like a check in bag?
No, that'd be perfect. It literally is like a two prong. It's like this big. It has little knobs. Some of them, like the bigger ones that, you wouldn't wanna bring probably in your carry-on, but some of the bigger ones have a timer. So you
Okay.
literally can plug it in, turn it on, it's gonna automatically stop at the 10, 20, 30 minutes, so you would know by coming back, like, I'm safe, it's already dissipated, but the little travel one doesn't. You can still smell it. I mean, it's still powerful.
Right, right. And Dr. Tammy, for our viewers that might not know about ozone, could you just kind of like say it briefly, like maybe in a short sentence, what ozone may be or what ozone is? And
Oh, yeah, that's a good point. I guess people don't know. So ozone is probably, one of my favorite gases is as far as we can look and pick a gas. So I think of it, ozone as being that smell in the air when we have a rainstorm. Right. So you go outside, there's thunder and lightning, and there's that cream, like that crisp smell. That's ozone. So ozone's O3. So it's oxygen with another molecule of oxygen on there. One of the reasons I love it, obviously, we use it all the time in practice. Ozone plus things that are in our blood that shouldn't be there kills it, right? So it's great for killing mold spores, whether it's, in the air, on surfaces. It obviously gets rid of odors. So, gosh forbid you walk into that Airbnb and they have a plug in, right? Oh my gosh, for our MCAS people like me,
now,
instant migraine.
yeah, that's true. That's true.
Do you do ozone treatments? You do, don't you, Dr. Gabby, in clinic?
Did when I was like at the height of my journey with getting rid of the mycotoxins in my system and going through obviously as you know the whole home remediation that I had late last year. I did had a chance to do a few sessions. Mostly I did actually with an IV ozone, and that actually helped me quite a bit.
Good.
Yeah, yeah.
And it's not, I always tell people that it's not a mold remediation strategy. Like this is Dr. Gabby and I are trying to talk through, like as she prepares for spring break. I got back from my 2-week vacation. The worst thing that can happen as an MCAS person or as a mold warrior, the worst thing is you plan for this R&R, you're going to get away with your sweetie, you're going to go to these amazing places. You're going to get hit with altitude on the plane. You're going to get hit with mold exposure in the Airbnb. We're just trying to keep you as safe as we can. So if you're living
Exactly.
in a mold environment, we're not saying plug in an ozonator and you'll be fine, because it can actually make some problems worse. It can cause fragmented mold structures and it can cause things to go airborne. It doesn't to get things in the wall. If there's something in my wall, it's obviously not going to address it. And it's not in replacement of a filter to keep your air
That
safe.
is true. That is true. Because I often have had some of my patients asking like, "Oh, can I just use ozone and then be done with it?" I'm like, "No, there has to be actual removal, and you need an actual professional, do the whole small particle cleanup, whatever needed to be done." And I mean, these are kind of things that kinda helps, but it's not like what you said, it's not with the intention for curing, I guess, or getting a full on getting rid of it 100%. And I mean, of course, we're not asking for people to that you need to be living in a bubble. It's just a way of being just more prepared and when you're traveling, right? If either if you've been sensitized or have struggled with mold, or let's say maybe you have not encountered that problem, but you want to be more prepared for it. But for sure, for those of us, such as like Dr. Tammy, myself, for those of us that have been sensitized, like we're like the canary in the coal mine. We know right away when we're in a place like, okay, there is mold. I get full on a little bit of some mast cell, which usually gets triggered more like migraines, other than I feel like that brain fog and fatigue that I don't feel any better until I actually get out of that environment. I don't know what if it's the similar for you, Tammy, but each one of us may have a different thing. But I've seen some patients that they have like full on severe, like joint pain, they cannot even move, or then they have more like POTS type of feature, which is can happen in mast cell. Maybe in one of our episodes, we'll discuss about the whole mast cell activation, and maybe we'll have one of our experts that we're inviting over for that. But for each of us may vary, but we're just want you to kind of be more prepared. for those.
Exactly. Like, we don't want you to go and to totally have a flare, ruin your whole vacation. You've spent 3 grand. You don't have anything. You don't have binders with you. You don't have an ozone. I'm not saying that it's going to work every time. What I'm saying, it's going to be important. The last thing we want you to do is you just remediated. You have all your clean clothes, everything. You walk into a moldy hotel room and you colonize all your other stuff, right? Like, so we're just trying to do everything we can to make sure you're the safest you can be, sort of like bed bugs. We don't want you to go in, get a hit of mold, get everything moldy, and then you take it home and you colonize your brand new house. I mean, it's not really going to do that, but
Right. Did
we
it
want to.
for you, Tammy, about like because I'm assuming you guys chose the Princess Cruise because of reputation and what you guys have been already before, right? With Princess Cruise and have tried that. So do you feel like it does help for patients or anyone in that when they're planning to travel, when they're planning to do vacation, to pretty much like read about it online or even reviews? Because one thing that me making plans with my husband, because we're planning our family vacation for the summer, we're going to be going to Europe. And one of the things which my husband is he's now even becoming a mall expert. He actually started reading like the reviews when he was like booking all our Airbnbs. And he's like, I actually not gonna book on this place because I read the reviews and they said that they had mold in their bathroom. So I think that those kind of things usually help if you get more. I feel like knowledge is power. I guess the more you know without stressing about it or becoming a bit OCD, but you can definitely find out if there is a possibility of anything like mold in the place where you're going to stay with your family or yourself.
Yeah, so I've traveled on Princess quite a bit. Don't judge, but I've been on a Princess cruise longer than a year. I think I've done 3 around the world cruises with them. So I've been on a good percentage of their ships. If I haven't been on the exact one, like this time it was Ruby Princess. I'd not been on before, but I'd been on one of the sister ships. I've known a bunch of the officers before. I know their stringent controls. I know that if there's a leak, they're on it. They're ripping out the carpet. You'll see if there's a leak, there's literally a fan there. There's a remediation crew that's already nailed it. So the one thing that I will warn that's tough, and anybody who's been on a cruise knows about that. The one thing that's tough about it is they do use really, really strong chemicals. So when you're MCASy, it can be a huge trigger. And so I just warn people, like if you went on it, Gab, you might notice that like you come back to your hotel room after a day and you instantly get a headache. There have been times where when I was on one of the world cruises and I was super MCASy still, I would come into my room and every day I got a headache. So basically on day 3, I talked to my room steward and I was like, hey, listen, I have a disease where I don't tolerate chemicals. Is there any way you can just clean my room with vinegar and water? Can you just use something? And they do it out of the goodness of their heart. Because as you guys have heard, probably GI bugs and stuff, if they get on a ship, they spread like wildfire and everybody's sick. So they do it for the right reason. But I couldn't tolerate it. Now, Gio had a little bit of that this time. He couldn't tell if when he came back to the room, he was getting a headache from that. So same thing. You just tell your steward, hey, can you knock it down a notch? We understand.
Right, right. And I feel like that's completely a good approach. I have to say that at times, because of that, many times in hotels or things like that, I usually just, forego like not having them to even clean the room until I'm officially leaving, especially when I'm going to conferences and just staying like a couple of days, something like
Well, that
that.
makes sense.
I try to avoid having like anything major cleanup. I mean, they always like knock and ask, and I said, no, I'm fine. Or I have said sometimes, do you mind just making the bed or, or kind of like a light cleaning, but nothing major. So yeah, I completely understand that because I've been also sensitive to chemicals and we both have patients that also suffer with this, especially once you've been diagnosed with that mast cell activation issue. So definitely could want to have information about the place where you're going, kind of like get yourself well versed, read things online, reviews, potentially give them a call. You might not be bothering them, of course. I mean, they want they want to serve you, they want your business, right? So they will be They might not be 100% telling you, "Oh, yeah, we had a water leak and we're having mold," like, you but at least you can always try to ask. So that's good. Now, I guess the next thing would be is, like, since we were talking that you have this separate travel kit, your emergency, your mold travel kit, what is actually if we get to open it up, what is in there? Like, we're talking about probably supplements, right? And I can kinda chime in and tell also a few of my things are my favorites. Kinda, like, walk us through how that would look like or what you carry with you?
Yeah, I actually brought something for show and tell that I always usually have in my purse. Now, granted, I don't always have a purse. I usually run around with my phone and my wallet. So one of my favorite things is, and this is literally we give them away like when we see new patients. It literally is a little kit where this one is my toxic mold binders. Now, this obviously isn't enough for a 2-week cruise, but I made CSM into capsules here. Well, let's be honest, Geo made CSM into capsules here. I have charcoal, I have clay, I have Corella. Basically, whatever mold I think I'm being exposed to, I have a binder for it. So this always goes in my purse because traveling again, you can't. Gabby and I are going to speak, whether we're on a TED Talk or we're speaking to a bunch of physicians or we're at a CM. This never leaves my purse. So I have one like this. My other one is my digestive enzymes. So I always carry those two. I never leave home without all the antibiotics I might use and all my antiparasitics. I won't in depth go into certain antiparasitics that start with an I, but I
Yeah,
never leave home without that.
you may have to be careful with that one. Yeah, yeah,
We
get it.
do. We do. Because that stops viral replication. So if I start feeling a little under the weather, I have that. I just typically have a Zithro just in case there's some traveler's diarrhea. On a cruise, if you ask for Imodium, you're asking for a stay in your cruise cabin without leaving for 3 days.
Wow.
And so it's one of those things where because of the thing about GI, right? If you have a GI bug, they don't want you spreading it to your neighbors, to everybody at the buffet as you're grabbing and being gross.
Right, right.
So I always have Imodium. I always have Pepto. In terms of binders, I always have charcoal. Charcoal is universal. Not only does it work for things like GI bugs and 4 of our mycotoxins, not all 5, but it works for 4 of them. It also, if you have a little too much to drink and you have a charcoal, which I haven't with
That's
MCAS
a
and
good tip.
mold,
That's a good tip, especially if you're traveling. I mean, I know you don't currently drink.
don't partake.
Well, and I have personally, throughout the years, have actually greatly diminished any because I used to enjoy more glass of wine, which I still do, but I just have to be careful with the histamine reaction, which I can get with that. But I can say that even charcoal, you can find it, especially if you're in the US. I mean, even if you're like in outside the US or even, I don't know, Latin America, because I've had experience obviously coming from Dominican Republic. Those are things that you can find potentially over the counter, but I guess in a cruise might be more limited. So might as well try to travel with those for yourself. And again, if, for those of you, obviously, Dr. Tami has the different binders because she is an expert, right, in managing these kind of things for patients. But when you guys are in doubt, obviously talk with your doctor
Of course.
and I wouldn't just randomly go online and start buying all of these differently without you knowing how to even use it, of course, right? But something safer and actually even for kiddos or which charcoal has been even we've used it. I remember when I used to use it even in the ER when I was a resident and working. We would kind of like help on for that for somebody that had even like an overdose and to speed things up. And I was like, what is that a black dust that people are eating? And that was my first experience with it. And I was just pretty much I was a baby doctor. I was in residency. So yeah, it's much more easily available. But other things like Dr. Tammy was mentioning earlier, like the CSM, that's like the cholestyramine. Those usually you do need to have, obviously, like a prescription for that.
And the thing about mold illness, like Dr. Gabby's saying, you can't just dabble. I see a lot of people that have kind of bounced around to practitioners. When we get people, and obviously Dr. Gabby and I both being canaries, we get people that are super sensitive. We work with Dr. Nathan, He's our one of our gurus. So we have complex illness people, right? So we know what to do. We know our own bodies. We'll teach you how to know your own body that well. And you probably already do. But sometimes, taking a handful of charcoal can make things better, not worse. I mean, can make things worse, not better. So
Exactly, exactly.
that
Yeah,
that's the
you
last
never
thing.
know. I guess depends on where you are, but, like, right now, since, like, for myself, since I had actually even recheck on my mycotoxin level and everything have come back down, so I'm actually kinda backing off a little bit from it, but, I'm not going to be reacting to it compared to somebody that is, like, doing it for the very first time. And kind of like also mentioning about, because I know you mentioned antibiotics on that and antiviral. Of course, you do need to have a prescription for those kind of things. But even for my patients because I have patients that are like, that I do see that I'm their primary care doctor, that they just want to do preventative and they always like, hey, doc, what should I travel with? I may recommend them anyway, something like the charcoal that as a binder, something simple in case they do get sick or have like loose stools and that kind of problem as well, since that worked fine. But then obviously I do recommend like, hey, let's prescribe you something for traveler's diarrhea. Again, we want to avoid the antibiotic resistance. So I'm always telling them, if you don't need it, please do not use it. So, and also if they're coming back, then, or if they're going to be in a place that is really well known that you can catch like a parasite quite easier. I would definitely say like, hey, travel with these just in case, or kind of give them some guidance of like what they should go get. Like I had a patient of mine, again, she hasn't had, I mean, they did had some mold exposure. I did treat it, the wife for like Lyme disease. And but they had moved into a country Latin America for just a short period of time. So during our she just called me like acute, kind of like for an acute visit. And I was like telling them, hey, you can actually buy this antifungal over the counter over there. And they were having something differently. It was nothing related to actually like with mold per se. But that is something that I tell them, that can definitely help. And my patients appreciate the guidance. So obviously, when you plan on taking anything that is prescribed, don't just decide to buy it randomly in the black market or online. It's better for you to consult and talk to your doctor about it.
Because you can be sensitive, like Dr. Gabby and I are. We don't dabble, right? Like we do structured because we know as canaries that would kick our asses, right? And that's the last thing you need is to compound and put an intensification reaction on top of what's going on. So, one of the other things I bring and I want to talk to you guys about is what to do with your nervous system,
Well,
right? Because
that's
this,
good.
right? This
Yeah.
isn't this isn't all just physical reaction. It's important that there are other things at root cause here. So one of the things that I find is super important is I do travel with my pulsetto.
That's good. And that's
Yeah.
easy. That's like, it looks like a little kind of like a necklace type, right? That goes around the neck and yeah. Yeah. So that's good for vagus nerve.
Super easy. Super
Awesome.
easy to pack. So the way I look at it is I want to bring it. I have that. I always bring my Apollo because it's usually on my bra.
I
So I
follow too. I always bring my Apollo. My vagus nerve that I use as a vagus nerve stimulator, it's a Travago.
oh, do you like it?
Similar as the Pulsetto in the sense, I mean, it's pretty much more rounder. I wish I would have it with me right now, but it's much more rounder. And then it's pretty much with two prongs, and you just put it kind of like around where you would leave your Pulsetto. And then it's pretty much like around like 1 to 2 minute treatment. So it's actually very effective for that. And then of course I've recommended my patients the same one that you have, the Pulsetto, as well as the Sensate, which those are great for vagus nerve stimulating. But even also if you're like having that fight or flight response because you're, I don't know, you're scared of like getting on a plane or you have a tendency for having much more stress with traveling, I feel like those are go-tos, which is not as good for not just our sensitive patients but also for people in general.
Exactly. And so one of the things you can do And Gupta, who's one of my favorite, people to redo your nervous system response, he says that if you get so good at his program, you can step into a moldy room and stop your body from reacting if you get good at the nervous system reprogramming. What I will tell you, I'm never going to take that dare. I'm just not. Like, if I walk in and there's black mold, I'm not even going to bring the suitcase in. I'm just going to be like, okay, we lost that money. Peace out. Let's go find somewhere else. But that being said, one of the things that's scariest about this, and this is why we want to talk to you about it, we can keep you safe even if you have a little bit of a higher level exposure. And the big part of that is convincing your nervous system that it's in agreement with this, right? Keeping it calm, keeping it chill, keeping it knowing that even though it might want to run from the mold tiger, you're safe. And whether it's an Apollo or a Pulsetto or whatever device, doing your Gupta or Annie Hopper or Primal Trust or whatever you use to bring that down and calm down the limbic system, you are going to be able to enjoy a great vacation no matter what the mold exposure looks like.
Exactly.
So that was a big one for me. We always bring the Pulsetto. What else do we have? So we have binders. Forgot nasal spray. So we love nasal spray. The reason we love nasal spray is, where does it all start, right? It starts from colonization, and it's going to affect our sinuses.
That
So
is true.
do you bring a nasal spray with you, Dr. Gabby?
I do usually actually bring in like the nasal spray X Clear routinely, which is kind of like my go-to.
Beautiful. So, and that'll stop if you are getting a mold hit, that's going to stop it from getting worse and colonizing. So I'm a big fan of that. What else do I like? Oh, another thing, and I think Gabby and I have talked about this, I always bring a pillow because that is the biggest surface. Sometimes I get really anal and I bring a sheet too, but I always bring a pillow. It's what your head's in contact with. You talk about, if, gosh forbid, that's a moldy pillow. It's been around forever. You had, who knows, John Smith sweating on it the week before you arrived, and there's no way for them to clean that innard, right? I'll either bring a pillow, or the other thing that I will do is I'll bring like an allergic pillowcase so nothing that's in there will get out. Well, we're almost done here. So we dealt with binders. We dealt with what we like to bring. One of the things we can talk about is, how do we pick a hotel room? So Dr. Gabby talked about that a little bit, about her husband who's very mold savvy after everything they've been through. One of the things I know I do when I'm looking at Airbnb or hotels or whatever else is, what kind of materials do they have? Is it a new build? Because some people are super sensitive to VOCs. Do they have, carpet? If they have carpet, it's out, right? I'm not going to book something that has carpet. I'm going to look for hardwood or vinyl plank. What is the other thing I think? A new hotel I will like, because obviously people are horrible to hotels. They spill things. They have water. Kids are running down the hallway, especially if there's an indoor pool or an indoor hot tub. So these are all things that when I'm scrolling through, I'm going to look for. The age of the hotel. Obviously, you can't tell that so much with an Airbnb, but, if it's a new brand, obviously, if you're sensitive to VOCs, that might be bad. Airbnb, like Dr. Gabby had said, you can read through the comments. If the comments say there's mold in the bathroom, keep on moving. There's also a Facebook group for Moldies and travel. And a lot of times every city will have something on there, like good hotel to stay in, good Airbnb. I stayed there, watch out, all of that. Thank you for joining us in the consult room. We're grateful you spent this time with us diving into practical strategies for safer, healthier travel. Remember, awareness is power. The more you understand how your environment impacts your body, the better equipped you are to prevent flares and respond early. Small intentional steps can make a significant difference in how you feel while traveling. If this episode was helpful, share it with someone who may benefit. And as always, if you need personalized guidance, we're here to support you. Until next time, travel smart, stay aware, and take care of your health.